Hello and welcome to PodcastDX, the show that brings you interviews with people just like you whose lives were forever changed by a medical diagnosis. I'm Lita.
I'm Ron.
Jean Marie is not with us tonight because she's not feeling well, and collectively we're the hosts of PodcastDX.
This week's topic may be especially upsetting for some listeners and may not be appropriate for young listeners. Parental discretion is advised. Today we are talking about suicide awareness and prevention with Corey. If you or someone else you know is in a suicide crisis, or if you or someone else you know are thinking about ending your life or their life, please seek help immediately. Here in most areas in the United States, you can call 911 or 1-800-273-8255. Again, that number is 1-800-273-8255 or 1-800-273-TALK.
Abiding by the most current guidelines for talking about suicide, we want to focus on the positive. We want to talk about Corey's work helping others. We will not be sharing any specific details regarding Corey's non-fatal suicide attempt.
Corey is a suicide attempt survivor. He is a father of 2 boys, a chaplain, and an advocate for others who may have suicidal tendencies.
Hello, Corey.
Hi, thanks for joining us.
Hey, how you doing?
Pretty good.
Yeah, it's a good day.
Of course, we're in Chicago area, and it's cold over here. You're in Texas, correct?
Yes, ma'am. Yes, ma'am. Actually, today is pretty nice. It's been very, very cold here, too, like 19 degrees.
Oh, that's cold.
Yeah, that was the coldest day.
Oh, okay.
Okay, let's get started. As our language and perception evolve, so does the terminology we use. For instance, the antiquated use of the term commit often unintentionally implies a sin or a crime. When we talk about suicidal self-directed violence, it's vital that we use terminology that is patient-focused and focuses on the fact that this is a mental health condition and not a crime. The use of a more objective phrasing is suggested, such as currently died by or from suicide, ended their life, or even took their life. If we're using the right language, if we're removing negative connotations from the language, talking about suicide, it may be easier. Similarly, we want to avoid the use of the phrase failed attempt, which suggests that dying by suicide equates with success. Using such biased, self-directed violence terminology may reinforce the negative quality and heighten the stigma of suicidal thoughts or behavior. It's important to remove the stigma in order to open communication with people that need care.
Well, the American Psychiatric Association, they have their own idea on what risk factors might be associated with suicide. For instance, if there was a previous suicide attempt, that would be the biggest risk factor. And other risk factors would be a history of suicide in the family, substance abuse, a mood disorder like depression or bipolar disorder. If they had access to lethal means, for instance, having a firearm in the house. If they have a severe loss, for instance, if they had a breakup or a death in the family, legal difficulties, financial difficulties, if they're bullied, we hear a lot about that, bullying. If they have a history of trauma or abuse in their past, if they have a chronic physical illness, including chronic pain, or if they have exposure to suicidal behavior of others, those could also be risk factors. Do you have a previously diagnosed mental health condition, or do you have any other risk factors that we just talked about that might have influenced you?
Oh, absolutely. And to tell you the truth, I think anything can influence you into that. You know, you can go anything in life that you go through this a misfortune. You know, it could, losing a job or anything like that could cause it. Anything.
What do you think was your biggest risk? What was your biggest risk towards it?
My biggest risk was my best friend had completed suicide and died a year before that, and it gave me the idea,
Okay.
kind of like a contingency, and And that, because if he hadn't have done that, I probably never would have crossed my mind, because it wasn't a common thing. And it's a small town here, and it didn't happen, and that was like the first time I ever even heard of anybody doing that, But that's what kind of put it. I'm not saying I did it because he did it. I'm saying that the idea came in my head because it happened.
Oh, okay. All right.
Corey, a recent CDC report says that it is really a very complex condition. The report says that there are many factors contributing to suicide among those with and without known mental health conditions. But having a mental health condition could be a contributing factor for many people. It also says that about half of the people who died by suicide did not have a known mental health condition. However, many of them may have been dealing with other mental health challenges that had not been diagnosed or known.
That's true, right? And Corey,
absolutely,
right?
I don't have a previous mental disability, but
Okay.
there's so many things that you can put that on,
Right.
If you don't have a mental disability,
Okay.
but having a mental disability and having depression and being bipolar, stuff like that, it really amps it up to where it really affects you in a lot harder ways.
Mm-hmm. I could understand that for sure, sure. And we all want to help prevent suicide. That's part of the goal, right?
Absolutely.
Right. There are warning signs that is on that American Psychiatric Association website. There are warning signs that they tell people to look out for. Were you aware of some of the warning signs that they talk about? Like,
isolation's a big one.
Isolation, sure.
That's very dangerous, because when you get alone with your thoughts, it's like a tornado in there. It's just all stirred up, and you can't have a straight thought after a while. And it's just, isolation is not good. That's one of the main things I was trying to tell everybody: do not isolate. Reach out, talk to somebody.
Okay, all right.
But other than that, people they'll quit caring about possessions. They'll just start giving away their stuff. Hey, you want that? You can have it. And stuff like that, and just people, emotionally being on edge, where their mood swings are up and down. I mean, just anything out of the abnormal, out of the normal. I'm sorry, but I've always been a people watcher, and like just watching and seeing, I don't know, trying to pick out certain little things. You know what I'm saying?
Mm-hmm. Right.
But like, why would they be doing that? Like the other day, I was just driving down the road, and this like a 10-year-old little kid was walking down the road with his head down, and I just saw that as a sign of depression.
Mm-hmm.
Just trying to read, and I actually turned my car around, and I was going to go pray for him, but I don't know. I guess he jumped the fence and went home or something. I couldn't find him. But it's just I try to always watch, and I'm always try to focus on other people.
Sure. Like if you see that they have mood changes, like, they're normally up and happy, and then all of a sudden they have a mood change, that could be a warning factor.
Absolutely. Like on Facebook, there's people that I see posts from all the time, regular people. If I don't see a post from them for a couple of days, or I'll message them and ask them if they're okay. I'll try and dig into it, and because that's, not the normal.
Right. Right.
Something's going on, and usually that's the case, that they need to talk to somebody, or they need prayer or something, and every time I'm like, look, if something happens, reach out. Don't isolate. You got to keep pushing forward. You got to do, the more you feel like you're in that situation, the more you got to do to stay out of that situation. In my past, when I would get like that, I would do the opposite. I'd try to run away from it, and we got to run to it, run to the people, not away from it.
Just so that we can help our listeners out, Lita started talking about some of the warning signs from the APA. I didn't know if you wanted to complete that to educate our listeners, Lita.
Sure. Well, for instance, you were talking about withdrawal or isolation. Also, if they have an increased use of drug or alcohol, that could be also another warning sign for people, if they increase their use of drugs or alcohol. And if they make comments about being hopeless or helpless or worthless, a lot of people say that. And that's obviously a big warning sign if they really feel that way. So you got to reach out to them and explain that, they are not worthless, that they have a lot of worth, that, it's very important that they're here on Earth, right?
Oh, absolutely, absolutely. Yeah, I try and instill that in everybody I talk to, because
Sure.
everybody is, just as important as the next person.
Right, right. And another thing you could look out for is if they have risky behavior or reckless behavior. People that are driving too fast, or people that don't wear their seatbelts, or, taking extra risks that they shouldn't.
Right, right.
That's another
Being
one.
careless.
Being careless. Right, right. So since we know about all of those, and you do have a Facebook presence, do you use those kind of tools to help monitor that site? Or do you have somebody in the mental health profession that will monitor the site with you, that can watch for warning signs of the people that go to your Facebook page?
Actually, on my Facebook page, there's nobody that's a licensed counselor or anything like that. It's all people with loving hearts and that has been suicidal at one point. Most of them anyway, and they just had the heart to help somebody else, out of the same prison that they were in, just like me,
Right.
If I hadn't have gone through that and been there, I wouldn't, how would I be able to help these people? How would I know what to do?
Sure.
I wouldn't understand how far you can get. It gets pretty far down there.
Do you ever make recommendations to these people and give them like local phone numbers, or do you follow up with?
Oh yeah, absolutely.
Okay.
I mean, I tell them whatever they have to do to get the help they need. Go to the mental. If they need to go to a mental hospital, go there. If they need to take their medicine, don't stop taking your medication. Take your medication if you need it. Stuff like that.
Sure.
A lot of people, they want to stop taking their medication, and it's like, no, if you need medication, you need to take it.
Right.
Sure, once you're on it, continue it.
Right, because actually a
Yes.
sudden drop of medication could actually cause a mood change.
Yes, exactly, and that could cause somebody to be suicidal, just that alone.
Exactly.
I just pray. I pray a lot. And I just let God guide us where we got to go. And
Right.
I just pray that, I just pray that He lets us get one more every day.
Right.
It's just.
There's a recent report from the Center for Disease Control saying that suicide is a very complex condition. The report says that there are many factors contributing to suicide among those with and without known mental health conditions, but that having a mental health condition could be a contributing factor for many people.
They also talk about the protective factors, right? The protective factors that buffer individuals from those suicidal thoughts and behaviors. There are protective factors, like you were saying, Corey. The cultural and religious beliefs that discourage suicide, right?
Uh-huh.
And family and community support. I mean, that's what your Facebook page is all about, right? Connecting people to other people so that they can share and learn from them.
Absolutely.
Right.
Absolutely. I just never heard putting that terminology.
Yeah, well, the Centers of Disease Control, that's how they are. But
Okay.
there were a couple of other ones that you might be interested in, because I know that you want as many tools in your toolbox as you can use, right?
Oh, absolutely.
Well, one thing that they say is that if people that have suicidal tendencies, if they have easy access to a variety of clinical interventions, so in other words, they know exactly where to go if they're really at their worst condition, and they have the phone number on their refrigerator or taped to their phone, and they know who they can call. You got to have that suicide hotline ready, because there are professionals at the other end of those hotlines that can help.
Oh, absolutely. Matter of fact, there's a suicide awareness company like that. I don't know if it's company, nonprofit. I'm not sure the name of it, but they're working to get a 3-digit number that goes straight to a suicide prevention hotline.
I've heard about
Right.
that. I've heard about that. Yeah. When do you
And
think that's going to come out?
it's going to be pretty soon, I believe. I'm getting messages about it. So, like saying that it's happening soon. But from what I'm hearing now, it's supposed to be 988 is what I'm hearing right now.
Oh,
That's gonna be
988.
the number.
Okay. All
Yeah,
right.
but it's not in effect as of yet. But it'll be all over Facebook. As soon as I find out, as soon as I get a green light, I'm posting it everywhere. So I mean,
Oh, for sure.
and there's also there's a text line that people can text. You can Google it. I don't have my phone in front of me right now.
Okay.
You can Google the text line, and you can actually text people if you're suicidal, because a lot of people can hide behind the keyboard and actually get the help they need, whether they don't want to call somebody. I've run into so many cases where, they said, I'm glad that we have this platform on Facebook because I can message you in text, because I wouldn't have called, and that's, for a lot of people, that little curtain right there where you can't hear them gives them enough confidence to actually reach out and get the help they need. So, I mean, there's so many avenues for help. It's people just need to not isolate and actually reach out and get that help. There's so many people out there willing and just waiting. It's just, I mean,
And
it's
as
a
long
good
as
thing
we
that
have
the
some people that
there.
are willing to help, we can help them along and hopefully stop them from doing something irreversible.
Sure.
Absolutely, absolutely.
Ron, what can we do to help somebody that may be in a suicidal crisis?
Right. If someone is indicating that they are considering suicide, just listen and please take them seriously. Do not be afraid to ask questions about their plans. Let them know that you care and that they are not alone.
Like Corey was saying, get into their life, be part of their life, right?
Yes, yes. I mean, you can't just. I mean, because if you just ask them if they're okay, they're going to tell you yes. You gotta keep asking. At least ask 2 or 3 times.
Right, and you got to watch for those warning signs like the risky behavior and the excess drinking and drugs, and you got to watch for all those, right?
Oh yeah, anything out of the ordinary.
Right.
Just start. My thing is just slow down and start paying attention to other people.
Okay.
I mean, the signs are. They're there. If it's not normal for them to be doing something, the signs right there.
Right.
You just we gotta slow down in our own lives long enough to be able to see them.
Sure.
I found that text number.
Okay.
You can text 741-741, and they will tell me suicidal, and a counselor will text you right back.
Is it 741-741? Is it twice?
Yes,
Okay.
and it's free. It's especially for teenagers. Our young adults and our teenagers are really, getting this pretty hard. I know I read a post the other day, from 10 years old to like 15, the suicide rate has tripled in the last 2 years. So it's really hitting them hard. They're young and they're they don't know where to turn. When if I was that age, I wouldn't know where to turn.
Mm-hmm.
So we gotta have the awareness out there. We gotta be their voice.
Right.
So is this, Corey, is this a national number?
Yes.
Yeah.
Okay.
Text her. Yeah.
I mean, don't you think it would be like beneficial if it were in the schools? If people
sure.
knew?
Yeah,
I mean,
they should have that.
Oh, absolutely.
Yeah, they should have that
I've
on
never
the
heard of
bulletin
it.
boards.
That's
Yeah.
kind of where I'm going. I think it would give more young people, as you say, a voice, even though they're not speaking. They would be able to reach out to someone without actually having to speak.
Right. Yeah, because
Exactly.
if you realize that there's somebody that's in trouble, you're supposed to encourage them to seek help immediately from a knowledgeable professional.
Mm-hmm.
Don't leave them alone.
Right. And if you're concerned about a friend or a loved one, make sure you try to keep them as safe as you can.
And reduce access to lethal means. If there's any weapons in the house, get rid of them. Lock them up.
Listen to them. Listen to what they have to say, because what they say and actually what they don't say can be important.
And right, and just being there with
Right.
them, just being a part of their life and being close to them could help.
Oh yeah,
And
just loving on them, man. Love, love does so much, and compassion. You don't have to trip out and get mean and anxiety and all that. Just love them, Just try to understand them and be open minded to what they're telling you about. Don't be, oh well, that's you're not thinking that, and just listen to them. If they're telling you something, they're being serious.
Absolutely.
And so many people just let it go right by. And it's if somebody's reaching out, stop and just love on them. Don't
Yes.
get crazy. Just show them you care. That little bit right there is just it does so much.
Well, Corey, recently Jean Marie and I took a course in mental health first aid, and apparently, from the statistics, you're far more likely to come across somebody with a mental health crisis that needs first aid than you are with like a broken leg or needing CPR. Chances are you're going to come across people. What are your feelings about that?
I agree with that. I think most of us, have, if not all of us, have something wrong with us.
It's that complicated of a world nowadays, don't you think?
Yeah, and it's like whether it be anger or anger, pride, jealousy. Any of that, or depression, anxiety. Everybody's got something, But there's a lot of people that have more than one thing, and it combines, and it just
Yes.
it weighs on you.
Yes.
And that's why we're trying to be that light and be that little area where, hey, if you're having anxiety, call us. We'll talk you down. It's not like that. We'll just try anything. My group on Facebook, it's not just for suicidal problems. If you're having a problem with anything, if you're having a problem with your boyfriend, you can put a post on there. We'll help you out. It's just people helping people. It's just people loving on each other. And that's what it's about.
Right.
And
reduce the amount of isolation.
Yeah, and just show people that you care. That's what everybody wants. Everybody wants to feel like they're cared for and loved. Who don't want that?
Well, we appreciate your insight, your personal insight. If there's one thing that you would like our listeners to take away from this episode, what would that be?
Don't give up.
Okay.
That is
Great advice.
Yes.
It's not the end. It can be worked through. Suicide is a permanent solution to a temporary problem. Reach out and get help. It doesn't matter if it's my group, Facebook, Twitter. If you call the text line, if you call the 1-800 line, get help. There's so many people trying to help, and they're there. You just gotta use it.
Very good. Well, Corey, thank you so much for joining our show today. This can be a difficult topic. It's a difficult topic to talk about. How can our listeners learn more about you and your advocacy? What is the name of that Facebook page?
They can look up. My group name is Suicide Prevention and God's Helpers. They can also look up my name on Facebook, Corey Burris with a K, and or they can Google my name. It'll pop up. Just I'm all over Facebook. I'm in over 500 groups, and I'm admin in about 20 groups that are suicide and self-help groups. So if you type in suicide on Facebook, you're going to find me somewhere.
Okay. All right. All right. Well, thank you very much for joining our show.
Oh, thank you very much for letting me get on there.
Okay. You have a good day, sir.
All right, you too. God bless you.
Take care.
God bless you. Bye-bye. If our listeners have any comments or questions related to today's show, and if you're thinking about ending your life, please seek help. If needed, please call the emergency services. In the United States, you can call 1-800-273-8255. 1-800-273-8255.
As always, please keep in mind that this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment and before undertaking a new health care regime. And never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast.
Till next week.